So, afternoon, everyone. I'm not sure how many more people will join, but I think we'll start now anyway. My name is Ella. I'm one of the 6 med tutors. I'm also currently a fourth year medical student at the University of Manchester. And today's talk is going to be about how to stand out among other applicants in all different aspects of the application process. If at any point through the talk you have any questions, please pop them in either the Q&A box or the chat, and I'll answer them at the end. I hope you can all see my PowerPoint at the moment, and if anyone can't, just let me know. So just a little introduction as to what we will be covering today. So we're going to be talking about what you need to be doing before applying, standing out in the actual UCAS application process. We'll talk a little bit about interview, and then really, this next couple of months, I don't know, you'll all be at different stages at the moment, but over the next couple of months, years, you've got the opportunity to really stand out and shine and prove to the medical schools as to why you deserve a place in their university. So why is it important that we stand out? So roughly 10 applicants per place for medical school, which is obviously a lot. Some medical schools will be more competitive than others, especially if you're going somewhere like Oxford or Cambridge. Everyone who applies to medical school is very, very clever. They are all predicted A's or higher at A level. They likely got mostly A's, A stars, 7, 8s, 9s in their GCSEs. And so it's not good enough just to be clever. Everyone who goes into a career in medicine is caring, wants to help people. And so when you kind of turn up to your interview and they say, why do you want to be a doctor? And you sit there and say, I really want to help people. It's not that it's not enough. Obviously it's appreciated and it's a really important part of being a doctor, but you need to be able to stand out apart from just, being clever and wanting to help people. Also, you need to prove to your interviewers, to your assessors, that you want to do medicine and you'd be a good doctor, not necessarily a nurse or healthcare assistant or any of the other jobs in healthcare. So there's that aspect to it as well, where you need to be interested in it a little bit more than just wanting to help. In the grand scheme of your lives, this is quite a short time to shine, especially if you think about how short an interview is. Especially if you're in a multiple mini interview, you might have between 5 and 10 minutes to prove to that interviewer that you're a good candidate and that they should recommend you for a place. And also universities do want different types of doctors and hospitals. It's very important that we have a diverse group of doctors. We want people from all different backgrounds with all different interests and all different passions. And that makes a better team than just your sort of basic fit in a box doctor. And so different unis will want different types of doctors, but within them, they want interesting, passionate people. So we'll talk a little bit about work experience and what kind of work experience you need to be getting, and what kind of things you should be learning about while you're undertaking your work experience. So I've split this into 3 subcategories. The first we're going to be talking about is sort of an experience in healthcare. I know with you guys with COVID, this one has been particularly difficult to get. So if it's absolutely impossible for you to get work experience in a healthcare setting, then obviously the universities will understand, but I'd really recommend it. Especially if you come from a family where no one in your family is a doctor, you don't really have any family friends who are doctors, so you don't really know much about how healthcare actually works, other than from a patient's perspective. So the kind of things that are available would be GP practices. In my experience, GPs are really keen to have sixth formers, college students, shadowing doctors for a week or a couple of days. That's all you need, really. Especially if you're in a very rural area where they're not actually linked to a university, so they won't get medical students there, then often they're quite happy for you to just come and sit in and watch a couple of consultations. And they'll answer some questions for you. I would say if you just message your local GP and they say no, keep messaging other GPs. There's so many in the UK that you can try. I think when I was applying, I messaged 3 or 4 GPs and one of them gave me a placement. So just keep trying, but I would say GPs are generally a good place to start if you're looking for work experience. Hospital work experience is obviously great, and if you're interested in medicine, this is the one that might excite you the most. But it is more difficult to get into than GP, and usually you have to know a doctor who is already working in a hospital to get it. Some hospitals sort of pre-COVID were offering schemes in which you could apply for work experience, but it's not that common anymore. I would say as well, just with the hospital work experience, a GP work experience or any of the other work experiences I'm talking about are just as good as hospital. You will get the chance to be on placement in hospital as a medical student, so don't stress if you can't get into hospital work experience, honestly. Hospices and elderly care homes, again, used to be very popular before COVID because they would happily take anyone who wanted to volunteer. Obviously with COVID, it's a little bit more tricky, but if there is a local hospice or elderly care home who are taking volunteers, I really recommend it. Even if you're not interested in care of the elderly medicine, it's still great experience and will really push you outside your comfort zone and teach you some really valuable skills that you'll want to be able to demonstrate during your application. Healthcare assistants, so usually if you're slightly older and applying, you might have gone and done some healthcare assistant work over summer or for a year if you have taken a gap year. And basically what a healthcare assistant does is assist nurses, takes blood pressure, for example. Some can take ECGs and bloods, things like that. Again, great chance to have patient interaction and learn a bit more about how it runs behind the scenes, how healthcare runs behind the scenes. Vaccine drives, from people I know who are currently applying or who are just about to start medical school, vaccine drives and volunteering, with these sort of COVID checks, things like that, was quite popular because again they required loads of volunteers and you get the chance to meet people who are potentially very vulnerable, who are scared of vaccines, for example, and you will develop your communication skills so much just by doing those, and they are much easier to get into. If you're really, really struggling with getting some experience within a healthcare setting, there are online events where you can watch surgeries or you can talk to doctors. I can't really remember the names of any of the companies that run them, but they're, from what I remember, quite easy just to find on the internet. It's more something where you can demonstrate that you've shown an interest and been proactive about getting experience if you attend these sort of things. But if you are able to actually get into a healthcare setting and see what it's like from the perspective of a doctor, I would recommend that more. So why is it important that you go into healthcare settings and experience what they're like? It's very, very different to being a patient. This is where you'll be working. And, some people are kind of strange. They like being a patient. but it obviously is very different being a doctor. And also, when you go into a healthcare setting as a patient, you're not really seeing any of the admin that goes on behind the scenes, none of the problem solving, anything like that, prescribing. And if you do go and get this experience with a doctor, the doctor can talk you through what's going on. They can answer any questions you've got about what life is like as a doctor. You can experience the MDT, which stands for the multidisciplinary team. This consists of nurses, physician associates, physiotherapists, opticians, audiologists, loads of different careers, clinical psychologists. And there will be many people there who have jobs you've never even heard of. And it might be the case that you go to a GP practice and they say, oh, for one morning, you're just going to shadow the nurse because we don't have any GP clinics running. And when you do that, you find, oh, actually what the nurse is doing is much more enjoyable to me. I much prefer that. And you can talk to them about what their role is and how it differs from being a doctor. And it might be that you find something that you're more passionate about. With that as well, that will help you learn yourself why you want to be a doctor and not a nurse or any other member of the MDT, which is a really common question that comes up at interviews. Why medicine? Why not another healthcare profession? And if you've experienced it, you'll understand more why you want to be a doctor and not one of the other not specialties, but professions. You truly understand the role of a doctor. Many of you guys won't fully understand what, like, the wide range of activities like involved in actually being a doctor. The name itself, doctor, comes from meaning teacher. So a large actual portion of what a doctor does is teaching other people, teaching their patients how to be healthy, teaching medical students, teaching other members of their team. And then on top of that, there's things like safeguarding vulnerable patients. And then furthermore, there's like a million different specialties within actually being a doctor. And so if you shadow a doctor, you'll learn much more about the opportunities out there in healthcare and what is going to be expected of you as a medical student and a doctor in the future. You'll also be able to experience more what the lifestyle is like. Obviously, famously, it's difficult being a doctor, very unsocial hours, long days, sometimes no lunch breaks. And you can talk to members of the MDT and the doctors you're shadowing about how they've coped with medical school and being a doctor, and sort of the sacrifices you might have to make in your personal life that goes along with the career. It's an important thing to think about because obviously most of you will be still teenagers, not really thinking about having a family in the future, having relationships and things, but it's something maybe to reflect on before you start medical school. And also it shows proactiveness. Obviously it's difficult to get, and if you do get it, it just looks very impressive on your personal statement and in interviews. So more importantly, you need to have these longer term experiences. And what I mean by that is volunteering or paid work. And these don't have to be in a healthcare setting. So what's available? Obviously at school, you might have programs running like mentor programs, or some schools have sixth formers go into nurseries to help out, things like that. Tutoring, either in school or out school, is honestly a really great way of building your communication skills. If you're teaching someone something, that's actually quite difficult. And for any of you who haven't done it yet, I would recommend trying it, and it will really push you outside your comfort zone, and it will teach you loads of things, communication skills, organization. And you can obviously make money from doing it if you want to. Other paid work, some of you might be waitresses or waiters, barmaids, work in shops, work in retail. These are all great experiences and will teach you a lot. Again, organisation skills, dealing with your customers and teamwork, things like this. If you learn something from it, then it's a valuable experience. Volunteering as well. Many medical students, well, prospective medical students will be volunteering in some aspect, something. Again, I really recommend it. It's great for your well-being and it's really fun. And again, it will teach you about social skills, will teach you about organisation. It's really invaluable, and you can volunteer in anything and hopefully you'll enjoy it as well. Everyone I know who volunteers really enjoys it. And just generally helping in the community, again, very relevant in COVID times. If you have an older neighbour who can't go shopping and you're helping them, that, again, long-term experience, think about what you've learned from those experiences. And if you feel you have learned something valuable, then it's worth including in your personal statement. So why is longer term experience important? It shows dedication. Medical schools obviously are impressed if you manage to get a week in a GP practice shadowing a doctor, but that's just a week. And if you can show that you have been dedicated to one individual pursuit, then it's really impressive. And to see that you've done that on top of managing your A-levels is obviously great. It also shows compassion. All the sort of the ones that or most of the ones that I just suggested will show that you really do care about what you're doing and care about the people who are around you. Again, it increases your social skills. Any time when you have to deal with difficult customers or people who are unwell, or, you know, people who wouldn't typically be within your social circle, your social skills will be improving. Confidence as well. If you're constantly being pushed outside your comfort zone and dealing with new situations, your confidence will increase massively, and it will make you a more resilient individual, so that in the future, you will all, as medical students and doctors, face times when you're very confused or struggling with something. It shows that you'll have this ability to bounce back more easily. And there's loads of other transferable skills in all of these long-term experiences, which are completely relevant in medicine. The final sort of aspect of work experience isn't really work experience, but it's very important to medical schools. And these are sort of hobbies and passions that you might have outside of medicine. Examples of these will include being a prefect if you're a head boy or girl, heads of house if your school has them. Maybe you're in charge of organising clubs or helping run clubs. I know at my school you had the opportunity to start clubs or assist teachers who are already running clubs. Maybe you play an instrument or a sport. Especially if you play them to quite a high level. It's very impressive, very traditional medical student thing to do. And basically any other hobbies, even if you have like really weird, strange hobbies, maybe you like painting, maybe you like baking, maybe you like sailing, whatever it is, it actually is incredibly relevant to your application and making you a very unique applicant. Oh, the other one I included was school subjects. A lot of people who go into medicine take biology, chemistry, and maths as their 3 school subjects. This is maybe less relevant if that is you, but if you are taking a subject which is like less traditionally seen in medicine, for example, art or a language, that shows that you are interested in something outside of medicine and might be relevant to your application. I always talk to sixth formers about being worried about the subjects that they've chosen and whether or not they can get into medicine. As long as you're taking chemistry and one other science, you are fine. You will not be discriminated against because you are doing an arty subject or a humanities or a language. If anything, the skills you learn in those are just as valuable as you would in maths. For example, if you are doing French, then again, your social skills, knowing how to speak to people, is obviously greatly improved. If you're artistic, then you are probably very dexterous, which is great if you want to be a surgeon. Myself, I took geography because I was interested more in sort of global health and public health at the time of applying to university. So if you have a sort of strange school subject, thrown it in there for your A-levels, and you're really passionate about it, then that is something you can also speak about. So why do universities care if you have hobbies? Well, it shows that you're able to maintain a work-life balance. I know many of you guys will feel like you are not maintaining a work-life balance at the moment and you are just working all the time. The workload in medical school will increase, and then as a doctor it increases again. You need to be able to put time aside for yourself to do things that you enjoy. And medical schools do care if you have that, if you have the ability to fall back on something else when times get too stressful. They don't want someone who's just living and breathing medicine. I'm not going to talk about social skills again. Organisation as well, to be able to go to, flute lessons or compete in cross-country racing, on top of taking your A-levels and doing any other volunteering or work experience you're doing, shows that you are an incredibly organised individual. It also may show leadership, depending obviously on what your hobby is. And it shows passion as well. It is absolutely okay to be interested in things other than medicine. In fact, it's a good thing, really. And the other thing is, if you are at interview, you might be asked, how are you going to continue playing the flute or whatever while you're in medical school. So things like this, really great. And don't just try and throw something in that you're not passionate about. If you're passionate about something, include it and talk about it, because it is it's important. So let's say now you've chosen some things you're passionate about, you've done some volunteering and some work experience, and you've come to write your personal statement. I'm going to talk a little bit about how you can collate all those things that you've learned in those experiences and convey them to the application team. So some top tips: always think about what you learned. That's way more important than what you did. And literally with everything you're including in your personal statement, sit down and say, does that explain what I've learned from that? Does that show that I have grown because of that experience? Be as unique as you can. I would actually say try and avoid reading other people's personal statements, because you might subconsciously pick up things that they've said and include them. And obviously try to keep away from cliches. Sell yourself. You are obviously trying to sell yourself, and don't be shy, don't be overly modest. You need to show them why they want to give you a place. You need to tell them, you want me as your medical student and this is why. Be clear and straight to the point. Obviously personal statements for UCAS are very, very short, and if you want to fit a lot in, you really need to not simplify your writing, but simplify it. Not, get rid of all the waffle, get rid of any unnecessary words, things like that. Just nice, clear, straight to the point on what you learn, and remove extra words. I also recommend getting a proofreader. When I applied, my dad just read everything that I wrote, and then I would get my sisters to read it, my mum would read it, and a teacher at school, and that way you know, once you've reread your personal statement and a certain number of times, you'll think it's perfect because you'll stop being able to see the mistakes. If anything doesn't make sense, you won't necessarily be able to identify that. So make sure you get someone like with fresh eyes just to look over it and make sure that that it's at least grammatically correct and makes sense to read. So what to include? So famously, people include a motivation for medicine, and this is usually stuck at the start of the personal statement. What this usually is like a personal experience, which was the moment you realized you wanted to be a doctor. Obviously not everyone has it, but sometimes people, you know, try and think of one. Usually, so this is obviously a massively cliche thing. If you want to include this, that's absolutely fine, but just try and make it original and make it make sense for why you want to be a doctor. You know, I have read personal statements where it says things like, oh, I, you know, broke my toe and then I went into the hospital and they x-rayed it, and you're just like, well, why did that make you want to be a doctor? It's not a particularly, you know, special story, but for some of you, you will have very personal stories as to why you wanted to be a doctor. So just make sure it's unique and make sure you explain why that has made you want to do medicine. Obviously, if you like volunteered in a war-torn country or something and then you realized how important a doctor was, that is a much more solid motivation for medicine. You also don't necessarily need to include a personal story if you don't really have one. Talk more about how you've developed your interest in medicine, if you've ever been on any courses, done any sort of work in biology or something like that. Yeah, developing interests. It's especially important to include if you were the kind of person who became interested in medicine later on, and you know, it wasn't your dream for your whole life. You know, what sort of piqued your interest and what steps did you take to make sure medicine was right for you, to make sure you were interested in medicine. Then you must include some pieces on your work experience. I'll talk a little bit more about how to talk about work experience in a moment. And then usually people include 1 or 2 sentences at the end, talking about what hobbies they like to do, and any skills they have, their strengths that they have. So in terms of layout, so I'm pretty sure UCAS is 4,000 characters you're allowed to have for your personal statement, which is a bit less than a page. Give a very brief introduction and talk about that motivation to medicine. Talk about why you're interested in, you know, 2 or 3 sentences. And then most of your personal statement will be on your experiences and the skills you've gained from those experiences. It's really important that you link the 2 of those. Like, please don't just talk about, oh, I went to a GP, I did X and Y, and then in the next paragraph saying something like, oh, I am a great leader, I am organised, full stop. Those 2 must be linked. And then any other interests usually go sort of near at the end. And then you don't obviously need a formal conclusion in a paragraph by itself, but a sentence or 2 just to close your personal statement off, just make it nice and well-rounded and clean. So how to talk about motivation. So again, like I said, a lot of people include a personal experience, which is fine. Just make sure it's unique and makes sense. Yeah, unique. And then talk about how you develop your motivation. That's much more important. Again, any books you've read, MOOCs, which are like online courses, any workshops you went to which taught you about what life would be like as a medical student, or about the content you might cover in medicine. And keep the motivation short. It doesn't add a lot if you write a whole big story about something that happened to you. So just keep it to a couple of sentences. And think about your audience as well. When you initially apply, it probably won't be a healthcare professional reading your application. It will be an application team member who works for the university, but depending on the university you are applying to at interview, they will have copies of your personal statement, and you might have a station talking about it. If that station is run by a doctor and they read your personal statement and they're going to be asking you questions on it, obviously think about how they will interpret your motivation. If you sort of overemphasize like how exciting everything was, how brilliant it must be to be a doctor, and you completely disregard the fact that there obviously is difficulties, they might think, oh, this person doesn't really know much about what they're talking about. So just think about who might be reading the application. Also, be careful about, being rude about any other healthcare professionals, because it could be a nurse or someone else who is doing that station as well. So how to talk about work experience. Break it right down. Don't just overgeneralize. I would keep a diary if you are especially going to a GP or hospital for a week or two, and write down, like even in short bullet points, the things that you did. It's much more important to talk about individual experiences you had on your work experience than to say, oh, I had this work experience. I'll give you an example in a moment. And then with every situation you talk about, every example you give, make sure you talk about what you've learned from it. Include individual situations and not the whole. And then cut any unnecessary detail out. I don't know about you, but obviously I'm a few years older than you, but back when I was really young in school, we'd have to write creative writing pieces about what we did at the weekend, or what you did on your holiday, and you would, write it like, oh, on Sunday morning I woke up at this time and then I had my breakfast, and for breakfast I had this, and then at this time I did this. And I think some people, when they go to write their personal statement, think they need to include detail like that. So, say on this date I went to this practice or whatever. You really don't need to. All you need to say is, on work experience in a GP, I saw this, I learned this. And prioritize. For so many of you, you'll have done loads of work experience, loads of hobbies, loads to talk about, and then you'll come to write your personal statement and you just won't have enough words in your word count to actually fit all of that in. Prioritize the most unique, the most impressive, and the things which most clearly demonstrate what you've learned and what you think the university will want to hear. So for example, let's say you say, oh, I spent a week in a hospital shadowing doctors and nurses. I saw a dermatology clinic and spoke to patients. Obviously, if you've included that in a personal statement, that's not, it's not the most useful, it's not the best use of your words, is what I'm trying to say, because you've kind of given a lot of information but not told the person reading your personal statement any reason that that's made you want to be a doctor more, or it hasn't said, oh, I've developed X and Y skills from this experience. So you've kind of used two sentences to not really say a whole lot. They'll be like, oh, okay, great. But if you were to frame it more like, on work experience in a hospital, that's all you need to say. You don't need to give any more preface to it. I had the opportunity to speak to patients. One patient's had, let's say, cancer or something. While speaking to them, I realized the importance of X, Y, Z techniques that the doctor used in the consultation. So let's say the importance of using the correct setting to have these discussions, or whatever. I realized, talking to these patients, I was a strong communicator, and I demonstrated this by whatever the time that I was able to break bad news to a patient, or was able to take history or whatever. I was surprised when I struggled with, I don't know, the emotion, or with speaking in public, whatever it is you've struggled with. And so following this, I took steps to improve it. For example, saying like, I was surprised that I struggled with talking in front of big groups of people. And so following this, I decided to join a public speaking group and have done X and Y to improve it's all about weakness. I hope that makes sense. I didn't want to actually, write a piece because, like I said, you don't want to be reading lots of personal statements and worry that they're influencing you. But I hope you can understand more what I mean about how to write about your experiences. So I'll talk a little bit about interview now. So the first, probably the most important thing that I would like you to take from this talk is how to talk about yourself in interview, because I know it's something that loads of people struggle with. So the first thing is try not to be too humble. I especially see this when students are in interview and they've just done a role play, for example, and the interviewer says, how do you think you just did in that? And they go, oh no, I've asked too many questions or whatever. And don't do that. Be confident in yourself and always frame it as, I've done this well. I'm very proud that actually I was able to get to the bottom of whatever the diagnosis was. But next time I would have, or if I was to do it again, I would have included this. Don't, sit there and be unconfident in yourself. Always back up what you're saying with examples. So if, I remember one of my interviews, I had a question that was along the lines of, here is a list of important qualities that doctors possess, and it would say something like leadership, communication skills, integrity, and it would say choose one of these and talk about why you have it. So let's say you chose good team working skills. You can talk about how good you are working in a team and how much you love working in a team, but give specific examples as well. So say, I'm a good team worker. I at school was part of the play, and during this time we had multiple conflicts, and I was able to overcome these conflicts and work with the other individuals. Sort of frame it more like that instead of just being like, I can do this, just trust me. And talk about your experiences. If you've done the work experience, then include it, almost like bragging about it a little bit. If you've done the experience, you might as well talk about it. And just think about what makes you individual, what makes you unique. Maybe it's a passion, maybe it's a certain strength you have, maybe you found you are really great at talking to people, or you are able to put people at ease, or you're very good at problem solving, or whatever it is. Think about what makes you unique and what's important to you, and include this when you're talking about yourself. And sort of like what I said earlier, talking about weakness is something people really struggle with. If you were asked in an interview, what is your biggest weakness? Don't frame it super negatively. Say something like, I've always struggled with public speaking. I've always struggled with public speaking. And because of this, I've taken these actions to try and improve my confidence in this sort of area. And now I'm much more confident, and in the future, I will continue to build on this confidence by doing X, Y, Z. So frame as a previous weakness, something I've always struggled with public speaking. What actions do you take? I joined a club, or I volunteered for a play, or I decided that I would volunteer at a care home because that would involve speaking to a lot of different people. How have you improved? Now I'm much more confident, but I still acknowledge it as a weakness. And then how will you continue to improve? It's also worth just thinking, when I said keep like a little diary of what you did on your work experience, try and think of, especially if you guys have already done your work experience, you can do this now. Can you come up with an example of a positive situation that you saw in your work experience, something someone did really well that you think you'll take on with you when you become a doctor? Similarly, it's something someone did that you perhaps would have done differently. And also think about I'll just talk about these first actually. The reason I say this is because these really commonly come up in an interview, and it can put people on the spot when they've done the work experience a year or 2 years in advance, and then someone says, when you were on your work experience, what was something a doctor did that you think you would have done differently? And then you think, oh, I can't remember any of the specific details. So make sure you've taken these things into account. It's very important because medical schools, when you're a medical student, really want you to reflect on literally everything you've done. So it's an important skill you need to get sorted now. And why have you chosen that medical school? It comes up a lot. That's a really common question. And so you need to talk about things like whether you are more suited to a PBL-based university or a traditional style teaching university. Know about the area that the medical school is in. Is it campus? Is it city? I remember when I applied, Sheffield used to ask, what do you know about the city of Sheffield? Which obviously can put you on the spot if you're not prepared for it. So just really reflect on the decisions you've made, and you should know why you prefer one medical school to another. So it shouldn't necessarily be a difficult question, but it does catch people out. So they're just sort of things to bear in mind when you are prepping for your interview. Example questions that might come up talking about yourself. Why medicine? Obviously people hate this question because you can't just say, I want to help people, I want to be a doctor. Talk about what you're interested in, what you're passionate in. Maybe you're specifically very interested in being a surgeon and want to be very hands-on. Maybe you want to be a psychiatrist, you're very interested in that aspect. And it's much more easy to talk about this if you have had work experience in a sort of healthcare setting. And I've already talked about this, and maybe ask you, why do you want to study medicine at a specific university? No, why specifically? Please don't go to an interview without knowing if a place is a PBL or traditional style, because you will obviously struggle. Communication stations. So one example is like a role play station where they have an actor there, and you are told, you're going to be acting out a certain situation, and then you have to just do it. These are really daunting to people because you haven't really had much practice in doing them at your stage. They are more testing your skills than any knowledge you have. So usually they're not incredibly medical, but let's say it was, ask a patient about what's been going on with their, with some sickness or whatever, or with a chest infection. They're not expecting you to know everything about medicine. They're not expecting you to have this perfect knowledge. They're just testing how you deal with the situation, and they're just trying to see what skills you have. They're trying to see if you can stay calm, if you can be a good communicator, if you can get all the information that you required within the time frame, things like that. Be calm, because sometimes they try and get the actors to throw you off by, becoming really aggressive or crying or whatever. It's really important you just stay calm and think about what you're saying, and then you'll be fine if you do that. Always be compassionate, especially if it's very relevant to that situation. Most of you will be lovely, kind people anyway, and it should become natural to you, but just be careful, because I know a lot of medical students a lot of prospective medical students who I've done practice interviews with, who become so stressed that they become almost robotic in the delivery of role plays. And if you're asked to speak to, a cancer patient, and in your interview, and you become robotic and you're just saying so what happened, and you're not showing any empathy, obviously, you're not going to stand out as a really exceptional candidate. And think about what you'll say before. Just take a breather when you've just seen whatever the situation is going to be, and have a think, what do I need to talk about? And overall, the candidates who stand out in these role play stations are the ones who are incredibly calm under the pressure, and are able to have a nice manner with the patient, because that shows that even under pressure, even in an unfamiliar situation, you'll be able to put that patient first. Breaking bad news stations, also common. For example, the stations usually are like, you've run over your neighbour's cat, tell them, kind of thing. Again, you must be calm in these stations, approached by being honest and upfront about whatever the bad news you are breaking. But also think about pacing, which means obviously if you're trying to break bad news to somebody, you don't want to rush out with loads of words, loads of explanations, not giving them any time to think. So even just being honest and upfront, but just giving that information quite slowly, giving that individual time to process it, that comes across really nice. And when you see a candidate do that, that's impressive. And in medical school, we talk about something called chunk and check, which is more relevant if they're asking you to break more medical bad news. So for example, what it means is you give a bit of information and then you check that that individual understands it and wants more information. So for example, if you're giving a cancer diagnosis to a patient, you might say something like, so we've looked at your test results and the results have shown that there is cancer there. How are you feeling? What do you think of that information that I've just shared with you? Can I tell you more about it? And then they'll say yes, and then you give another bit of information and keep repeating it. So that's a really nice technique you can use. But the example the point that I'm trying to make is, if you are faced with a breaking bad news station, just think about giving a little bit of information, let them process it, and then give a little bit more information, but don't, be dishonest or whatever. But again, just be nice and calm, think about empathy. Real patient stations, these aren't super common, but it came up for me in my interviews where they had a real cancer patient and it literally just said, have a conversation with the patient about their journey with cancer, and you just had to sit and talk to her. Again, be really compassionate because these are real patients, and they've given up their time to talk to you, and so yeah, just be very compassionate and understanding and empathetic, and try not to ask any very impersonal questions, anything that might upset them. Give them space to talk, so ask a really nice open question and then let them speak. In my case, in the station where I had a real patient, she spoke quite a lot, so I literally only had to interject with a couple of questions, and then the rest was just empathy and body language. Don't over medicalize it. They are just trying to see how well you can deal with patients in terms of body language and social skills. They're not going to test you at the end of it if you know every detail of their medical history or everything about their type of cancer, for example. It's more about, can you show empathy to this patient? Can you have those discussions in a good way? So empathy. Yeah, there you go. I've already told you these. So ethics and decision-making stations, you might sort of on the outside think, well, how can I specifically stand out? I've just got to get the answer right. But I will talk to you a little bit about it. So in an ethics station, when you're given a question which is specifically dealing with an ethical scenario, answer in a calm and ordered way. So think about what you're going to say and then present it in a nice, clear fashion. Always give balanced arguments, because that is the #1 downfall of anyone that I've worked with. It's the most commonly seen ethics station issue is that they don't give balanced arguments. So for example, a question might say something like, you are a junior doctor, you've been bleeped to say that a stroke patient is attacking a nurse. There are multiple nurses on standby, but they want you to come and assist. and then you're bleeped a second time and a patient is choking and they need you to go and manage their airway, which do you go to first? Most people will say, oh, well, the individual who's choking is at more risk, it's more immediate risk, they might be on their own, whereas the other patient has multiple nurses. So it's obviously the right answer is go to the choking patient first. But that's not the point of an ethics question. You are meant to analyze it, think of the pros and cons for each sort of option available. So a much better answer for that would go along the lines of I would go to the choking patient first because that risk is more immediate, but there's a chance that with the other patient more people could get injured, or you need to give pros and cons to each option. Just balanced argument, just don't be really one-sided. And try and avoid your own opinions if you have a very strong opinion about something. If a question comes up on abortion, I can appreciate that not all of you can support abortion, for example, or support smoking, or whatever it is that comes up with drug taking. But you need to avoid judgmental opinions, because obviously if you're sitting there in an ethics station and you say, well, I wouldn't do an abortion because it's just wrong, and you don't explore the situation anymore, then that's not an impressive answer. That's not an answer that's going to stand out, or it will stand out, but not for the right reasons. So I appreciate that for some of you, there will be topics in ethics stations which might be touchy, but just try and approach from a more objective standpoint than a personal opinion level. And sort of also along the lines of that is, if in a role play an individual says something like, oh, I do drink alcohol, but I drink like a bottle of vodka a night or something ridiculous, don't laugh, don't pull any faces. So many people do that. It doesn't go down well at all. And also that's something you need to get used to, because real life people do that all the time, and you can't laugh in the face of a patient, you can't be judgmental in the face of a patient. And just have a good background knowledge of the ethics stations, because I'm always of the opinion that if you have the good background knowledge, you'll come across more confident, you'll come across more clear and ordered anyway, because you're just confident. Whereas if you don't have that knowledge, you're kind of clutching at straws almost. Yeah, someone's raised their hand. Is it just you want your... Okay, 2 people raised their hand. Okay, is it just that you want your question answering now? Background, okay. So when I say good background knowledge, I just mean the knowledge. I will talk a little bit about the things you need to know in a minute, but just background knowledge to ethics stations. You should know the kind of things that are going to come up. And apart from ethics stations, you don't really need to have much knowledge for interview, but ethics you definitely do. And some universities, if they've got a more sciencey station that will come up, they usually will tell you, obviously make sure you know how to calculate volumes and stuff if they say, oh, you're going to be calculating whatever. But in terms of ethics stations, I think I have a slide on it. What you need to know, yeah. So these things regularly come up in interviews in the ethics stations, and you should know what all of these words mean by the time you get to your interview. I can give you a little brief overview of what each of these are, but I would say at least write these down, just so that when they come up you can not be flustered because you've never heard of them before. And also, if they don't bring it up and you bring these up in your answer, it looks very, very impressive if you can talk about them. So consent, most of you will know what that means. You should know at what age in the UK consent to medical treatment is automatically assumed, is legal, things like that. So over 18s, for example, can consent to all medical treatment, and they can also reject life-saving treatment. between the ages of 16 and 18, we assume that they have capacity to consent to treatment, but they can't refuse life-saving treatment. And then below the ages of 16, we use 2 sets of guidelines called Gillick's competency and Fraser guidelines. The Fraser guidelines specifically about sexual health in children under the age of 16. Basically, they are just like legal cases which kind of frame the way we approach under 16s and deciding whether or not they have capacity to consent to treatment. And then capacity goes sort of hand in hand with consent. So to be able to assess capacity, you should know how to assess capacity, which is to make sure an individual understands the decision they're about to make, is able to retain the information you've given them, is able to weigh up any information you've given them about a decision, and then they're able to communicate their decision back to you. That's how you assess capacity, and you should know how to do that, basically. And you should just be aware, for example, that capacity is very time and decision specific. For example, if you've got a 12-year-old who's in your hospital bed, and they might not be able to understand and agree to a very complicated surgery, but they will be able to choose what they want for breakfast, for example. So it's ideas like that related to capacity you should just be aware of. The 4 pillars of medical ethics, I think quite a lot of you will know what they are and how to apply them to ethics questions. If you can remember them, they do look very impressive when you talk about them in your answers to any ethical scenario question. And they are justice, autonomy, beneficence, and non-maleficence. I'm not going to go into massive details about them, but just if you look up the 4 pillars of medical ethics, then you should be able to read all about them. They're quite self-explanatory, it's not too tricky, but just know what they are. Professionalism as well, you don't need to prep for as much, but obviously just being aware of things like not like how inappropriate it is if a medical student was to turn up to placement drunk, for example, and sort of it's usually questions along those lines. Just if you're interested in it, you can read, there's a document called Tomorrow's Doctors by the GMC, but it's kind of boring, and you know, you are unlikely to be tested on it unless you're told you will be. So just be aware that you might be asked about professionalism. Confidentiality, most of you all know, but just know when you are allowed to break confidentiality as a doctor. That question can come up. So obviously things like safeguarding, intentional breaking of confidentiality, for example, if someone wants an insurance form filled in, things like that. And then just accountability, just thinking about how we deal with when things go wrong. Making decision questions. So these are often like linked to ethics questions, but they're not so obviously ethics questions. It's kind of hard to describe what they are, but they might present a little bit like an ethics question, where something's gone wrong and you have to make a decision on what to do next. And answering them, you answer in the same way as you would answer an ethics question. Make sure your answer is really clear and ordered with good structure. Always give balanced arguments and make a conclusion. If you're asked to make a decision, whether it's in an ethics question or a less ethicsy question, if they say, what would you do? You must make a conclusion and not sit on the fence. Sometimes it's okay to sit on the fence, but if they've said, what would you do in this scenario? You need to say, you know, this is the pros, this is the cons, this is the other option, pros, cons, but the option that I will take it is whatever. So make sure you make a conclusion and give yourself time to do that. Don't run out of time. So for example, you prescribe the wrong medication and a nurse has gone to administer it. What do you do next? And you would, you know, talk about things like how the patient views healthcare. You know, would it undermine their trust in the healthcare system if you kind of burst into the room and said, no, don't prescribe it? What happens if they've already prescribed it? Think about beneficence and non-maleficence. Is this patient in danger, for example? And then integrity and professionalism also you talk about in a question like that. A question like that would be either the only question in a station or one of two questions in a station. So you'd have a long time to talk about it. And also just a quick one on dealing with weirder stations or stations you aren't expecting to come up. If these come up, just make sure you stay calm. If you don't stay calm, then you won't be able to think through the answers properly. Make sure you answer their question. If they've asked you to do something, just do it. Don't panic and go waffling off on a tangent. Just make sure you answer the question. And use knowledge and transferable skills. They won't ask you to do something that's ridiculously hard. It's even if it's something you've not prepared for, you know, you should still be able to adapt and cope with it. And if it goes really wrong and it's really thrown you off, try not to let it affect performance in your other stations. It's the beautiful thing with multiple mini interviews is that if one goes completely wrong, you can just, you know, pick yourself back up and move into the next station and pretend like everything's just been going perfectly. And, you know, you can fail one station in an interview and still get an offer. These are all questions that I've seen come up before, which are maybe a bit more strange, might not be expected. Things like the game 21 questions. I don't know if you know it, but it's it used to be quite a popular game where you'd someone would think of something and just a random object, and you would have 21 questions to figure out what the object is. So you would say something like, oh, is it an animal? Is it a plant? Is it a place? And then you would have to narrow it down. That one personally came up for me, and it's not medical related. I had to figure out that she was a rose bush. So that is something that does come up and can throw you off a little bit, I suppose. But is relevant to medicine. So, you know, question asking the correct questions is an important skill. Another popular one, describe an image. Where either you have to describe it to someone who can't see it and get them to draw it, or maybe I think Oxbridge used to do one where they gave you a piece of art and you had to interpret the art, and it would be very abstract. And then another one would be the average number of words in a book, or the average you know, volume of human head, or something like that, where there's no possible way you know the actual answer, but you have to use logic to come up with a good answer. So for example, you'd say what there's an average of 300 pages in a book, and this many lines on a page, and this many words on a line, and you'd work it out sort of like that. Those are the kind of questions that might come up in sort of strange stations to try and throw you off. Other things to consider, obviously, don't forget to prepare for your UCAT. You want a nice, good UCAT score or a BMAT score, depending on which one you're doing. Otherwise, you won't get your interview. And then obviously good A-level results. Don't, I know you guys won't, but don't forget that. And just know what your medical school is looking for. For example, Manchester wants very different medics to Oxbridge. And that's fine and that's great. Just know when you're turning up to an interview what exactly the type of person your specific medical school is looking for. And just be yourself, because that's what they want to see. They want to see variety. They want to see someone who's just passionate and really wants to be a doctor, and they know that you guys will be nervous and everything. So don't worry too much about it and just be yourself, have fun as much as you can, and yeah, hopefully it all goes well. If you have any questions, feel free to put them in the chat. I know there's a couple already in there. Yeah, someone's raised their hand. I don't think you can speak, so just feel free to pop it in the chat. Also, if any of you don't have any questions and you want to leave, that's also fine. Okay, so someone asked, what's a better way to say that it's a dream from your childhood? I suppose, that's fine to say, oh, it's something that I've dreamed of a long time. For me, I did want to be a doctor from a very young age. But I would just, it's fine to say like it's been a long time dream, but just say what actions you've taken to make sure that it's right for you. Focus more on things like I'm trying to think, like things like, oh, I was interested, so I went on these courses, or I read this book, or whatever, and I was already interested, but these made me even more interested. They've given me the sort of information that I need to like feel confident in applying for medicine and knowing what was right for me. Amy, I'm in year 13, of course we were applying, have 2 straight rejections, and I'm on 2 other wait lists after the interview. What advice would you give me as a re-applicant to put myself in a better position for next year also? Okay, thank you anyway. So the first thing is, like, don't worry at the moment. If you're on 2 wait lists, you still got a chance to get in. And I mean, with COVID, it's a bit difficult. Some medical schools do go through clearing, but they might be quite full at the moment. Lots of people take a gap year or do another degree and then come back into medicine because they don't get in first time. It's quite, it is quite difficult to get in first time, and just don't be too hard on yourself if you do get rejected from these other 2. It happens. All of us have difficulties like in our path, in our career. So first thing is just don't be too harsh on yourself. Don't be too upset or stressed. Get as much experience as you can, because obviously that strengthens your application, but also it will make you more confident. I always see reapplying as actually a really big asset to have, because you already know what it's like being an interview, you already know what the UCAT's like, and so going through a second time, you should be really, really confident. You should know what you sort of need to do, and you'll come across as a really impressive candidate. Just the other thing is, sometimes you can get feedback from your interviewers about what specifically were your strengths and weaknesses. And then obviously if like you didn't do so well on UCAT or BMAT, you'll know that that's your strength or weakness as well. Just reflect on those and make sure that you really work on your areas of weakness to bring them up to the same level as your strengths. And yeah, just reflect on what you could have done differently and then work on those and continue to get stronger and more confident. And then I'm sure, second time would be absolutely fine if you need to reapply. I hope that's useful. If you need any specific advice, feel free to, ask another question. And is UCAS first come first serve? Would I be a disadvantage if I submit my application to the deadline? I don't think you're at a disadvantage if you submitted the deadline. Medicine is an early application anyway, so you do have to submit your application very early, but I don't think they usually don't start properly looking at them till they're all submitted. And also, especially the bigger medical schools like Manchester, I know definitely does this. They do waves of interviews, so like the first people who get invited, they're kind of judged together, and then you're either accepted or sort of put on a wait list, and then they sort of do it in waves instead of just giving away the places to the first few good people, if that makes sense. I don't know if that makes much sense, but they have a certain number of spaces allocated to each wave instead. So no, you're not at a disadvantage, especially if you're working on your personal statement and making it better. Okay, what if the cancer patient is shocked and walks out? Well, like it's unlikely to happen in your interview because they're kind of there to do a job and you can't really continue with your station if they walk out. So I would be surprised, although that kind of thing happens in OSCEs if you do really badly. OSCEs is our practical exams that we do, which is very similar to multiple mini interviews in terms of setup. But I had a friend who was in an ethics exam station and he upset the patient and the patient started shouting. So I guess it can happen, but in your interviews it's unlikely to. I would probably take that as not a great sign if you've said something that upsets them so much. But I guess if that is the case, then just try and move on and be ready for your next station. But yeah, maybe try not to shock them, upset them, just sort of sit and talk to them. How do you recommend answering why medicine without sounding too corny with your answer? It's just like the question I get asked most, and I still haven't got like a brilliant answer for it because the question is always sort of changing. Back in when I applied, you could say things like, you wanted to prescribe, you wanted to be more diagnostic, but now these days there are many nurses who are diagnostic and can prescribe, for example. So it's a little bit more tricky now to answer it. But I would say if you're interested in research or surgery, that they are two like they must be medicine and not any other jobs. And then otherwise, talk about things like wanting to be an expert in the field, wanting to be like the more leadership roles, wanting to teach. You can obviously say you want to help people, but I would just frame it more that, I've had experience working with vulnerable individuals and I enjoyed those interactions more so than being like, oh, I want to help people, because that is quite, cliche. If they say I want to join medicine to help people, if they say there are other professions where you can help people, yeah, that's like, again, sort of what I was saying, they do say that a lot. Just if you get asked that, don't be rude about any other professions, because sometimes it's a nurse asking that question. So don't say like, oh, I don't want to be a nurse, because then they'll be like, wait, that's a bit rude. Like, it doesn't go down particularly well. So just say like something along the lines of, I appreciate all the members of the MDT, but I'm particularly passionate about going into medicine because I want to be an expert in the subject. I want to have the leadership role. I want to, whatever your reasons are for wanting to do medicine and not nursing or whatever. If you have a relative in medicine, how do you go about saying that you understand the challenges without making it seem like you're relying on your parents? That's quite a good one. I think it's not a bad thing to say, like my mum's a doctor, for example. And so I understand like the impact it can have on an individual. I know people who said that. I don't think that's a bad thing. Obviously, you don't want to harp on about it too much and try and have other experience that you've organized yourself, even if it's volunteering or whatever, a passion or something. So you can always say, like I've seen it firsthand, how my parents deal with it. Well, I've taken these steps to understand more, see if I would fit well into the role, sort of things like that. Because I suppose as well, you probably have a good understanding of what being a doctor's like, but you might not necessarily have, because you don't have that first-hand experience if you don't have the work experience. So just make sure you have work experience as well, and then you can kind of like back it up, if that makes sense. What do you think are some aspects that are exclusive to being a doctor? So like I said, leadership is a big one. Obviously, there are some nurses who are like in charge of wards, but especially if you're interested in like emergency medicine, leadership is a big thing. Becoming an expert in your field, actually getting more into the science, more into the understanding of why things happen, is like the kind of key point which differentiates doctors from other members of the team, because one doctor once said to me that there's like a saying that goes along the lines of 90% of a doctor's work could be done by anyone on the street, like it's easy, but it's when that 10%, when things go wrong, that you need to be a doctor to be able to deal with it. So you need to have the more in-depth understanding. And so I guess that's really what is like more exclusive to being a doctor. Obviously then, yeah, like prescribing is more common in medicine than other professions, I guess. And research is, I think you have to be either a doctor or a scientist. If you're a nurse, you don't really get involved in actual research, your own research, writing papers, things like that as commonly. So I would say those are all good points. Does anyone else have any questions? If I've not answered any of your questions well enough, please say I'll give it a go. If there's no more questions, feel free to leave, and good luck with all of you. For all of you anyway, sorry. It's okay, good luck, and hope you get in. Hopefully we'll meet in the future sometime. It's okay. Thank you guys for giving up your afternoon. Have any of the last couple of you got any questions? I'll just give you one more minute in case any of you are typing, but feel free to leave and good luck. And then in a minute I'll end the Zoom if there's no more questions. Okay, thank you guys. I'm going to end the Zoom now. Good luck with everything.